2020, and this is your latest edition of the TSJG Neighborhood News. We will be recording this and showing it tomorrow for your viewing pleasure. I'm your host today, Jessica Lopez, your Executive Director, and we have a lot to share with you this afternoon. As a reminder for our Zoom meeting tips, when you're not talking, please mute yourself, although all are muted right now. We would encourage you to use the chat feature at the bottom of your screen to ask questions, and Michelle or Valerie or one of the directors can let me know if anybody is chatting questions as I provide commentary on the various topics to make sure you get all of your questions addressed. That chat feature is a really great thing because I know sometimes by the end of the presentation you might have forgotten a question that you had on one of the particular topics. So please, we encourage you to use that chat feature. As a reminder, if your video is on, we can see you. And please make sure, if you're not aware if your video is on, you can unmute yourself later and ask. And as a reminder, we can hear all the background noises that are happening when you are unmuted later for our Q&A portion. So here is our COVID update for May 14th, 2020. The situation in Fresno County as of yesterday evening, there's been a total cases of 1,014. So total cases in Fresno County, 1,014. 48 are travel related, 433 are close contact, 400 are community spread or unknown, and 133 are under investigation. Total deaths has jumped from 9 previously when we last reported to 13 as of today. The total ever hospitalized in Fresno County with COVID is 143. An interesting note that when Valerie was on the call yesterday with the health department, I believe, they noted that their ICU beds are starting to fill up. So a lot of this increased activity as people are wanting to unshelter in place is driving more hospital admissions with COVID and more ICU bed utilization. So they're seeing the highest number of ICU bed utilization since we started tracking COVID in our local hospitals.
Jessica?
Yes?
I'm sorry, they also did mention that they're starting to see a rise in Fresno County in the nursing homes. So they didn't say which ones, but that they are seeing those start to rise.
Again, so all of these precautions we have put in place are ever more important. COVID is still around us, so we need to be screening our guests, our team members, and limiting exposure to the greater community, etc. The total ever hospitalized in Fresno County is 349. The total individuals that have been monitored to date by the Fresno County Department of Public Health is 2,603. Those currently being monitored is 652. They have processed now over 11,700 test results, and our local health department has processed 974 of those. So most of those test results have not been conducted at the local health department. For our current status, as of May 14th, 2020, our current standing, we have 0 positive cases and 1 PUI case. So 1 person under investigation, and that again is somebody being tested for COVID, whether symptomatic or not. And as you've seen us present in previous editions of the TSJG Neighborhood News, you'd recognize that now people are testing that are not symptomatic and have had no exposure. But we are still going to track those so we can track our total testing to date. So again, as of today, May 14th, we have 0 positive cases on our campus of residents and team members, and our total PUI cases is 1 that we are awaiting their test results. A new guideline has recently passed that's specific to our skilled nursing population that is regulated by the California Department of Public Health. And that new regulation states that we should provide cumulative data to our family members and residents. So rather than just share this information with the village residents and their family members, we thought it best to share with everyone And it is kind of interesting information, which is what is our cumulative data for San Joaquin Gardens specifically. So as of May 14th, we have had a total positive cases of 2. Both have since recovered, but those are the only 2 positive cases we have had here at San Joaquin Gardens. And our total persons under investigations, again, individuals who had been at some point tested for COVID, is 48. So again, kind of an interesting statistics as you look at that data to say that we have conducted 48 tests on our campus, or somebody going off campus for testing, and only 2 of those tests came back positive. So kind of interesting data for us to track as we continue along this COVID journey. So going forward, each session of the TSJG Neighborhood News, I'll provide our current data as well as our cumulative data. But I really want to make sure people recognize that is cumulative, you know, and those aren't our current stats. So I hopefully highlighted that enough both verbally and on the slide that there is no confusion.
Jessica, we have a question from Joe Lewis in the chat box.
Mm-hmm. I can't see it, so you'll have to tell me.
Sorry. Is the PUI a resident or a team person?
Going back to this slide, our current PUI case is a resident that chose to be tested. Thank you for asking. So again, going back to whether or not to test, I would like to reiterate this because we continue to get questions every week. As recent as yesterday, we received questions from residents about, well, I think I should be tested. And the reality is you have all the right to go be tested. And this is kind of the CDC guidelines on who should be tested, which again is going to really be focused on those that are symptomatic or those that are hospitalized are going to be considered the highest priority for testing. So those living in a congregate setting, such as San Joaquin Gardens, who are at the hospital are going to absolutely be tested. Those that are symptomatic are going to be tested. And that kind of walks you through kind of the high priority and the priority list. But and here's where, again, you can go locally to get tested. The first thing you always should do is contact your primary care physician. You can go to Fresno City College or the Optum Serve site in Sanger or the Adventist Health site to get testing. A resident asked us yesterday, well, can I get a test done here? We cannot perform a test unless the Department of Health directs us to perform a test on a resident or team member. The Department of Health will give us the direction and quote unquote the order to do so, and that would be in writing. We would follow suit, but they would actually be bringing us the testing materials as well. So we cannot, number one, do a test on any resident or team member unless it is driven by the health department. So you would have to see your primary care physician and or one of these sites should you want to be tested. Again, my caveat to all of this is that testing really is a moment in time. There still is not a 100% accuracy in these tests because COVID builds up in the system, and where you're at in the building up of COVID within your body will determine whether or not that test comes back positive or negative. And my concern will always be that our residents and or team members get a false sense of security by getting that negative test, because the reality is you should be aware of all of the standard precautions such as physical distancing, wearing masks, being aware of what you touch, not touching your face. All of those should be happening regardless of a test outcome. And a test outcome really just says in that moment, on that day, in that time, you are negative, but that could have changed 2 minutes after you took the test. So unless somebody is symptomatic or has been exposed, I'm not sure what the results of that test offer us. Because if somebody is symptomatic or been exposed, they should be self-quarantining per the direction of their physician or the health department until they get the results of that test so that they know that they are not exposing others to COVID. So unsymptomatic people being tested, I'm not sure what the upside to doing that is. other than having that knowledge for yourself. But again, that knowledge is really only telling you that in that moment that that test was taken, that it was negative. But as always, I want to remind you that if you decide to get tested, if your physician authorizes you to get tested, certainly if you're symptomatic, please let us know so that we can be tracking that data, following up with the health department, following up with your physician. So we would ask that you notify us via our wellness team, Valerie Epps or Carol Freeman, at their phone numbers or emails, and just let us know that you have in fact been tested so that we can follow up with you to determine the results of those tests. And most importantly, let us know if you are symptomatic so that we can work with the health department to get you tested and then follow up with that accordingly. So I'm going to talk a lot about reopening and COVID in the next few moments. So as I mentioned on our last call, we have been in stage 1 of the California's plan, which is the sheltering in place order. We are moving to stage 2 right now, which is authorizing other low risk businesses to open during this time as long as they are following the guidelines set forth by the state, and showing that they are allowing for social distancing, limiting the numbers of individuals within their business, etc. Stage 3 will allow for more high-risk businesses to begin opening up, which would happen at a later date. And it would really be based on the numbers that are growing in hospitals, and how well we're doing as a society as to not grow COVID numbers in terms of community spread. So there is no date for stage 3. Stage 3 would include schools opening, movie theaters opening, universities. You might have seen on the news recently that Fresno State announced that it would be going to an online only format come the fall. Most likely they are planning for that because there is no date for stage 3 and there is no timeline. So rather than wait till the last minute and develop an online curriculum, they are just planning for it with the understanding that COVID will be here for some time in our environment. So I want to talk a little bit about stage 2 and the reopening process and what that means for COVID exposure, and then obviously what that means for San Joaquin Gardens. So let's talk about COVID and how this virus is released into the environment. So why do we wear masks? Why is it important to wear those masks in public? We've seen it in other countries like China and other areas where it's almost a normalcy in society to wear masks. Well, the reason you wear a mask is not to protect yourself, but to protect others. We talked about that a lot on my last call with you all. So how are you protecting others? Well, a single cough will release about 3,000 droplets. These droplets are traveling at 50 miles per hour as you cough. Most of these droplets are large, and so they'll fall relatively quickly to the ground. But many can stay in the air and travel across a room in a few seconds. So that one single cough, that without a mask, that you expose all those droplets going out at 50 miles per hour, that's what you're preventing that from occurring by wearing that mask. So I just thought that was such a good visual to think of 3,000 droplets escaping your mouth through a cough, traveling at 50 miles per hour, and how many people that could infect. So again, that's not only why we're wearing that mask, to keep those droplets from traveling out at 50,000 miles per hour, but it's also, that's why the social distancing or physical distancing is so important. If both individuals are wearing a mask, one of them coughs, and they are at least 6 feet from each other, the risk of those large droplets, they're going to fall quickly to the ground because of gravity. So they're not going to go too far, but they still will go out there. So that's why both individuals wearing masks is so helpful to protect each other. A single sneeze, so ha-choo, a sneeze releases about 30,000 droplets. And these droplets are traveling up to 200 miles per hour. Did you ever realize how powerful your sneezes are? And some of us sneeze really cute. Other people sneeze like I do, which it sounds like a tree is falling in a vast forest. But that single sneeze will release about 30,000 droplets traveling at 200 miles per hour. Now, these droplets are smaller and they can travel great distances, and that easily can spread across a room. So when you look at why they're looking at restaurants and other indoor venues like that, is these coughs and these sneezes can travel so quickly and spread through the air to other tables and other patrons and residents in the restaurant, exposing them as well. So again, that's why restaurants are being looked at so readily. How do we safely open a restaurant? When you think of somebody sneezing in a restaurant and that's 30,000 droplets traveling 200 miles per hour, and how many people that could impact. Well, there's one thing you can't wear in a restaurant when you're trying to eat, and that's a mask. How do you wear a mask while trying to eat? So that's why that's considered a riskier environment. And we'll talk more about that in a moment. But even breathing releases droplets. So a single breath can release 50 to 5,000 droplets. These are mainly low velocity, except when you're maybe singing, because you are breathing at a stronger pace to try to project. So when you're speaking loudly, etc. But those single breaths will release droplets. There are even fewer droplets released through the nose. So if you're a mouth breather, you're going to be releasing more droplets than you would be if you're a nose breather. And now that I read that, I've been kind of conscious of if I breathe through my nose or through my mouth. But breathing through our nose is more important because it will obviously have less exposure for others. But we do need to breathe. That is important. Speaking increases the release of respiratory droplets about tenfold, so 200 virus particles per minute. Again, assuming every virus is inhaled, it would take 5 minutes of speaking face-to-face to receive a dose to where you could be exposed. So again, that's why wearing the masks, maintaining that social distance is important. And really what you want to look at when they do contact tracing for COVID, what they're looking at is how you were exposed to the virus and how long you were exposed to the virus. And that's how they determine your risk factor. So if somebody was jogging past you and they had the virus, that's a really minimal risk factor, because really you were only exposed to their breath droplets, and for a very short, depending on how fast they jog, but for a very short duration of time. So that would be a low risk factor. Now, if you were face-to-face with somebody for 10 minutes and they sneezed and coughed on you, you have a much higher risk of infection. In fact, anybody in that room would have had a higher risk of infection. So when they're looking at that contact tracing to determine the risk of exposure, they're really looking at, and there's been some really interesting case studies where somebody was at a party and was coughing the whole time, and how much exposure and how many people ended up having the virus versus others. So it really depends on the environment and what's happening in that environment, which is why it is so, so important for people who are symptomatic to stay home. We cannot stress that enough. Even if you think it's seasonal allergies, if you think it's nothing, when you look at these sneezes and these coughs and the risk of these droplets, it's not worth the risk. People need to stay home if they have these types of symptoms. So as we look at reopening and rejoining the world, one of the major risk factors will be public bathrooms. Even in an environment like ours, where we have high touch areas, we have protocols in place at San Joaquin Gardens for high touch areas to be routinely disinfected on an ongoing basis. But bathrooms have a tremendous amount of high touch surfaces. Think of the door handles, the faucets, the stall doors, touching the toilet paper dispenser. There are so many things you touch in a bathroom, and how many times a day are they touched and by how many people? The other thing that I had never thought about is the flushing of the toilet does aerosol mini droplets. So we really need to, as we emerge into this new COVID world, we really need to treat public bathrooms with extra caution. If any of you have ever gone to a public restroom, you can tell people that work in the healthcare industry. And the telltale sign is the people who work in the healthcare industry who use public restrooms rarely touch anything with their hands. They will walk out carrying the paper that they dry their hands with to touch all of the surfaces. So a big thank you to Brian and to Valerie for advocating that we go to touchless faucets in our public restrooms. So that's one less surface for us to touch. But just to be aware of washing our hands and trying not to touch anything, because really you can touch things, but after you wash your hands, you really should avoid touching anything in a public restroom and using the paper towels that you've dried your hands with for the remaining touch points until you get out of the bathroom area. So again, just something to be aware of, to be cautious of, and just to think about, like if you stand over that toilet as you flush it, all of that aerosol droplet particles come splashing up, especially some of the newer toilets that have those tremendous flushing, mechanisms that can produce those droplets in the air. So what is the role of asymptomatic people in spreading the COVID virus? Well, we know that at least 44% of all infections and the majority of community-acquired transmissions occur from people without any symptoms. So these are people that are asymptomatic or they are pre-symptomatic. So you can be shedding the virus into the environment for up to 5 days before symptoms begin. The viral load generally builds up in your symptoms. As the person becomes symptomatic, you are more contagious. So really just prior to your symptoms showing is when you are releasing the most virus into the environment. So the data is showing that 20% of infected people are responsible for 99% of the viral load that is being released into the environment. And again, that has a lot to do with this virus shedding when people are not showing any symptoms. And we've had people that are completely asymptomatic the entire time and had never shown symptoms. And then of course, when they are pre-symptomatic, that's when they are most contagious. So again, so important that we all wear masks and adhere to that physical distancing, because it's not like a normal flu where people are contagious once a feverish or what's called this virus is so that's why it is so contagious, because that contagion happens prior to any symptoms showing. So what are the commonalities of some of the biggest outbreaks? So I read a study, and this was sent to me by Julie Congo, so big thank you, Julie, for this excellent article. And they really looked at where the largest outbreaks stem from. And those outbreaks stem from environments that were enclosed with poor air circulation, a high density of people. All of that equals to a big troublesome issue. So all of these large infection events occurred indoors where people were closely spaced. They had lots of talking, singing, or yelling for extended periods of time. And I want you to remember that extended periods of time. So people were in these closely dense public places talking loudly, etc., for an extended period of time. So they were in homes, workplaces, public transport, social gatherings, and restaurants. These sources of infection account for 90% of all transmission events. So I'm going to say that one more time. The main sources for infection are within your home. So a family member becoming infected and you're living right next to them. In your workplace where you're shouting and yelling at each other and working in close proximity. Public transportation, social gatherings, and restaurants account for 90% of all transmission events. So some of the major examples they provided were the meatpacking plants. Those meatpacking plants, they have to communicate to each other in the deafening drum of industrial equipment. So they are shouting at each other for 8 hours a day. That's the only way they can communicate is through shouting. And again, think back to what I said earlier about projecting your voice and the increase in droplets that occurs. So they're in a densely packed workers. They're yelling and screaming at each other in an enclosed environment. So they are now responsible for outbreaks in 115 facilities across 23 states with over 5,000 workers infected. That's amazing. So when you hear that on the news, they don't really explain the why behind it. And the why behind it is that poor air circulation, high density of people, and they're yelling at each other to communicate. For the choir outbreak, this was a really interesting scenario that was covered in the news. You might have heard it. It happened in Washington State. And these people really were aware of the virus. They took precautions. They thought they were doing everything right. So they really took steps to minimize the transfer. They weren't doing handshaking. They were trying to socially distance themselves while they practiced for choir. But again, what do you do when you're practicing a choir? You are singing and you're pushing out your voice loud to project. And so these individuals, let me go back to, so they were in a enclosed space with not great air circulation. I believe it was like the size of a small volleyball court, if I remember correctly. The choir sang together for 2.5 hours, and they were talking and singing. They were doing this deep breathing while singing, which again expelled those droplets, and then they were breathing in deeply too, right? Because you have to take big breaths when you go to sing. And so for 2.5 hours, they were exposed on a continuous basis to some individuals that had the virus. So over a period of 4 days, 45 of the 60 choir members developed symptoms, and 2 of them passed away. So again, they were in this enclosed place, and then even though they were trying to be separated, there wasn't great air circulation, and they were expelling those droplets because of what they needed to do to sing. They needed to breathe in a lot, and they needed to push out that volume. And then the final case study that they read in this article was a family gathering in Chicago. So a gentleman went to a birthday party with 9 other people. They hugged, they shared food, they sat together for about a 3-hour period. Again, all of these case studies, extended periods of time together. This was in an enclosed place. It was in somebody's home. Of those 9 people, 7 of those people became ill. The gentleman who went to the party was hospitalized and later died. Of those people that were at that original birthday party, 3 of them went out and went to other birthday parties, went to church. In total, that one birthday party was directly responsible for infecting 16 people because of that one gathering of 9 people. So again, just looking at what the commonality is, I think is very interesting for all of us to look at as we look at what we're living in this new world. So I'm going to go into a little more detail about that, but that's why physical distancing is so important. It's why outdoor spaces are so important right now. It's really to protect yourself to have brief exposures or outdoor exposures. In those situations, you can really help keep that viral load to a minimum. When you're standing 6 feet apart, where there is wind and infinite outdoor space for those particles to go to, it can dilute in the air. And then, of course, other studies are showing the effects of sunlight and heat and humidity on the viral survival rate is lower. So it really is important, to have that physical distancing, and that outdoor space is so important for keeping this virus from spreading. So basically, the formula is for you would need exposure to the virus plus time. So when we really look at this new world, as we look at these closures are being loosened, as we start to venture out more and start resuming normal activities, we need to look at our environment and make some judgments in ways that we never have before. So we need to look at how many people are we going to be around, how much are we in the event, how long will you be at the event. The number of people increases the potential risk of exposure. Less environmental space increases the risk of exposure. You're more apt to breathe in those droplets in an enclosed area. And the longer the time spent equals the amount of timing you are breathing in that exposed air. So we just need to look at our new normal amongst COVID is just being aware of our spaces, being aware of who we're going to be around, and making good judgments for ourselves to limit our exposure to COVID. So for example, when you look at the risk of infection at a grocery store or a mall, this is what you have to consider. The volume of the airspace at a grocery store, very large, tall ceilings, big wide aisles. If you look at a Target or something like that, there's a lot of airspace. Right now, why is the government restricting how many people can go into these places? Because of this very reason. Less people means less risk of exposure. And then how long will you be at the store? A worker will be there all day. A customer may be there for an hour. So if I'm a person shopping at a grocery store, there's low density of a population, especially if I'm going during senior hours that are really limiting how many people are going to be there. There's a high air volume in the store, and I'm going to be there for a restricted amount of time. That means the opportunity for me to receive the virus is very low. But for the worker who's going to be interacting with people all day long and who's going to be there for a full 8 hours, they have a higher opportunity to become infected. So I wanted to give you all the groundwork for how the virus spreads, what's important, what are we considering here at Human Good as we plan for unrestricting our campuses, and just to remind you how blessed we are to have a team of professionals that are laying all of this data and are looking at making recommendations for phase 1 of our unrestricting our campus. So phase 1 will include unrestricting dining, some activity gatherings, and some campus visitation. And by next week, we will have recommendations from the Environmental Design and Infection Control Committee. But there's a lot of data out there. They've taken all this information, and they're being very conservative. But we also know that we have in this new normal. We can't live in fear. We can't live with these full restrictions where everybody's held up in their apartment and no one's going anywhere. And the data is showing if we're smart and we plan, we can live in COVID successfully. We just have to be aware of it. We have to plan for it, and we have to put provisions in place to keep our campus as safe as possible. So that's the background that's leading us into how we are going to unrestrict our campuses. I can say for the first phase of dining, as it's not going to be a surprise to you, we'll be going back to pickup option for our residents. So again, the brief amount of time you're going to be in and out of the space, less exposure. Most of that time you'll be walking on campus where there's great volumes of air. So again, very limited exposure. Our team members are vetted, wearing masks, very limited exposure. That's a good phase 1 of dining. And that would allow us to return some normalcy to our campus with a very low risk of community spread for COVID. When we look at activity gatherings, looking at doing it in outdoor spaces. As I just went through all of those case studies, it makes sense why our phase 1 for Human Good will be allowing small gatherings of people with physical distancing and masks in outdoor spaces. That's a good phase 1. It's safe. It makes sense based on the data, and it allows for us to return to some normalcy within our community. The campus visitation might look at people coming and directly visiting for a succinct period of times in the resident apartments directly so that they're not at risk of exposure to other residents. So more information to come on all of this, but I wanted you to have the background, the thought, the knowledge, and the understanding of everything that we were looking at as we look at unrestricting our campuses. I've heard from many of you that it's overwhelming, it's scary, and it's lonely right now. And I thought about that loneliness word, and I want to remind everyone, loneliness is proof that your innate search for connection is intact. And that's a good thing, because we know how important it is to have connection in our life. So now it's important for us to take charge of that search for connection and develop our new normal as residents of San Joaquin Gardens. So my first tip for all of you to overcome this overwhelmingness of COVID and this lonely feeling is to stay connected. Make a plan to call family members. On every call and committee I'm on, I'm encouraging residents to make a daily commitment to connect with other residents, to call their family members, call their friends, call people you don't know, but make a goal to call a few people every day to stay connected. We are creatures that want to be with one another. And that's what drove us to become a part of this campus to begin with. And I want you to know that you're not the only ones that feel this way, that feel this lack of connection. I feel it. I'm used to being with you all every day physically, so I feel that same loneliness and that lack of connection. And I know that even just doing calls like this, it fills my cup. It makes me feel so much better because I feel connected to all of you, and I feel that sense of family again. So I want to encourage all of you to stay connected. Make those phone calls. Use Zoom. Use Skype. Join Party Line here at TFG. But find a way to stay connected that works for you. But plan for it is, I think, the key versus it happening happenstance-wise. I think the other thing we all need to do is actively engage. Many of you through the years have heard me speak about Ikigai, which is a Japanese concept that means my reason for being. What is my Ikigai? What's my reason for being? Well, my Ikigai is all of you and this team, and making sure that all of you feel loved and protected and cared for. And I get to live that every day, even in this weird, different environment where I don't get to physically be with you all. I get to live that Ikigai. So what I would encourage all of you is to sit back and think about for yourself in this new world that we're living in with COVID. What is my Ikigai? What is my reason for being? It's going to shift slightly, but in your core, you are still who you are. And your Ikigai is the same. It's just find new your story, new way to get it. You might have been somebody who will go and visit other levels of living and spend time with those residents, and you can't physically do that. But is there another way that you can live that reason for being during this time? So what you can do during this time is find a new way to provide this. Maybe learn something new. Share positive articles or stories. There was even research on that. More if you're on Facebook or other social media, sharing positive stories out to your friends and family can boost your depression levels. It can actually increase your positivity. Becoming pen pals with one of our team members' children. It's going to look different for all of us, but all of us need to sit down and take a moment and think, what is my reason for being in this new COVID world, and how can I live my fullest life during this time? This time shall pass. This is a finite moment of time. We will get through this, but it's how we get through this that will define us as individuals and as a community. I cannot stress how important everything that I read and research tells you to go outside. This is the best time to live in Fresno. May is such a beautiful month here. Go outside and go for a walk. Go garden, even if it's on your porch or your balcony. Sit and meditate on the lawn. Sit outside and listen to the rustle of the leaves. I like to tell my children those are the trees dancing, and we sit outside at night and we listen to the trees dance together. And just for that few moments, you feel this sense of peace and calm come over you. So studies show that being around nature actually boosts your immunity and wards off depression. So go outside, whether it's in the morning when it's still cool and crisp, or just to sit outside for 5 minutes on your balcony, but plan for doing that once a day. That goes to the next tidbit, which is to create a schedule. Everything I've read is said during this time where everything is topsy-turvy, it's really important for you to still schedule for yourself. That in the morning, I'm going to make these phone calls. In the afternoon, I'm going to do this. Kind of make a list for yourself, cross things off so that you can, at the end of the day, feel accomplished that you've done something. And accomplish something is so important to kind of track those proactive steps. Number 5 is my personal favorite, which is find sources of comfort. Maybe it's reading a book or taking a bath or eating your favorite food, whatever it is. Allow yourself to have those moments of comfort and that serenity that kind of comes over you when you do your favorite thing that brings you joy. As you residents, let's create something. There's reasons why artists enjoy becoming swept away by their work. They get to be, it's therapeutic for them, whether they're writing a book, writing an article, doing a painting rocks, or dancing. That creativity allows them to be swept away into another world that wards off loneliness and depression, and it can be therapeutic and positive for their soul. So those are my tips for becoming overwhelmed during this time. As a reminder for all of you to wear those masks. If I haven't stressed that enough in all of the data that I provided to you, I really want to encourage you. And I know it's getting a little warmer and maybe not that comfortable, but just to keep it with you, if you don't have it on physically the whole time, if you see someone coming, please put it on because of that droplet precaution. Hold on one second. Okay, there we go. So just don't forget to wear that mask for the shelter-in-place guidelines for Fresno County. It is required, but we really just want to encourage each other to wear those masks. Oh, no, my screen's under there. There we go. We talked about this last time about why to wear a mask. I'm not going to read them all to you, but at the end of the day, you are wearing a mask to protect others from your cough. It's a big statement that you take this COVID seriously and that you want to make sure that others feel that sense of safety and security. So please, please, please wear those masks for the benefit of our entire campus and our community, which we all love so dearly. And again, residents have provided, and if you have other tips, I really would love to hear them, but your tips for wearing a mask, leaving it by the door so that you don't forget. All of our team members are handed a new surgical mask when they come through the gate, so they have it on as soon as they get out of their car. But really, find different ways to make it a part of your normal routine. And I already, when I was delivering hummus on yesterday, I saw so many of you making it a habit now, and so many of you open the door wearing it. And so I think we are getting better at this, which I just can't tell you how much I appreciate, and I'm so thankful for all of you to do that for the protection of others. Thus far, I have received one poster for our poster contest, but I know there are a lot more creative people out there. So I just want to encourage all of you again to get creative, design posters to encourage our residents to wear their masks or physical distance. Posters will be due to the concierge by May 20th, and we will announce on our May 21st call who our winner is. So all participants can make any size creation. So if you want to make, a huge poster to bring into us, that's welcome. But the minimum size is 8.5 by 11. So get creative, have some fun, and share our philosophy of being a community that honors each other and protects each other by wearing masks and physically distancing. Again, want to reiterate that, and we've been receiving emails for our dining emails, so keep those emails coming. Our dining leadership team appreciate it. So again, our email is sjg, oh my gosh, did we get it wrong again on the slide? sjgdiningservices@humangood.org. We just spelled it wrong again. I feel like this is cursed. So we will get it fixed before we put it on the slide. No, it says SGJ. It is not correct. So we will get that fixed. So we want to remind everybody, we only are getting about 20 to 25 orders for the alternative menu. I don't know if that is because the regular menu has been so stupendous that you don't feel the need to use this other menu, but we want to remind folks it's here. So we're going to remind you twice a week on these calls and on Touchdown. But if you'd like to have any of these brought to you in place of your regular lunch or dinner entree, that is available for you. And I've heard good things about it. So we would encourage you to continue to utilize it because, again, our goal in dining services is to really delight you during this time of sheltering in place. And as we said earlier, eating your favorite comfort foods is important. So please continue to email us about what those foods are and things you'd like to see so that we can make sure that we're doing our best to please all of you. Wednesday, our next dining treat will be served on May 20th, and it is Strawberries and Cream Day. So did you know that strawberries have more vitamin C per serving than an orange? Raspberries can be found in assorted colors, including gold, black, and purple, but of course red raspberries are the most common. And technically, the blackberry is, haven't anybody say it's a triplet or a cluster of fruits like a bunch of grapes. So anyway, lots to be known about superfood, which are berries. They're very good for you. Blueberries don't have as much vitamin C as other berries, but they are packed with something that I can't say that is very important. How do you say that? Phytonutrients. But anyway, we want you all to stay healthy, so we're bringing you some strawberries and cream next Wednesday, May 20th, for y'all to enjoy. So celebrate Strawberries and Cream Day. And that is a picture of my homemade strawberry jam that I made last weekend. The resident birthday bunch lunch return. So resident birthdays will be celebrated on the third Thursday of each month, and all of you are invited. So on the third Thursday of each month, we will be celebrating with a special campus-wide lunch. All residents will receive this special menu for lunch on the third Thursday of each month, and you will also receive a list of all the birthdays that we are honoring on that birthday party, so you know whose birthday you're celebrating. For the birthday group, those individuals that are actually having the birthday in that month, you will receive a Zoom party invitation to party with me via Zoom as we honor you for your birthday. The birthday residents will also receive a special bunch cake with their meal for that third Thursday of each month. So they get a special bunch cake, get a Zoom invitation to party with all of us, and we hope it'll be a good time for us to celebrate and honor you. So we'll be celebrating March, April, and May birthdays on May 21st. And at 12 p.m., those that are having birthday in March, April, and May will be invited to a Zoom celebration that they can attend or not. And all of you will be receiving a special lunch on that day in their honor. So if you haven't received your Zoom invite, please let us know if you have a birthday in March, April, or May, and we will make sure you get that invitation. You all asked to know what your dining points receipts will be returning. So yesterday, Wednesday, May 13th, dining receipts were printed and put in all of your message boxes. Receipts will now be placed in message boxes with weekly menu every Wednesday. So we are officially opening up the resident message boxes for usage. So you can start going to your message boxes, and on every Wednesday, you will find your menus as well as your receipt for your point usage. I thought there was one more about that, but maybe not. So let's look at the sunny side of life and some things that are happening on campus. So as many of you know, Kona Ice, a shaved ice treat, will be here this Friday, May 15th from 10 a.m. to 2 p.m. They will be located throughout the campus. So in the Tivoli parking lot for the Milano residents and assisted living team, et cetera, from 10 a.m. to 11:10 a.m. Then they're going to come over and try Valencia, where they'll be for an hour from 11 to 12. And then we're going to have them go over to Sequoia and Tuscany in the streets between those two neighborhoods for the rest of the day. So on Friday, May 15th, look for the Kona Ice truck between 10 and 2. It will be driving throughout campus and stopping at these locations. Please honor physical distancing when you're ordering your treat and wear your masks when you're going to pick them up. So Valencia resident message boxes are back in action, as I just mentioned. So information will be returning to your message boxes, which will include our menus, your dining points receipts, as I mentioned, the weekly and monthly garden news, all of our event flyers, your monthly statements, birthday cards, etc. All of that will be going back in your message boxes. Again, we just ask that you honor the physical distancing when collecting your message boxes. So if we see too many people piling up there, we'll intervene and maybe put more direction in place in terms of who can go when to check it. But I think we're all smart enough to wear our masks, and to, if we see somebody there that we're going to have to get too close to, kind of step back, wait for them to leave in order to go check our message box. If you'd like your message box content delivered to your apartment on a weekly basis, just again call the Connect line at 430-8216, and we can provide that service for you. Oh, I did need to mention the Valencia entrance next to Pete's Coffee will be temporarily closed, and that is so we can funnel traffic appropriately to the village office per state guidelines. So that little cut-through area between the village office and Pete's Coffee will be temporarily closed while we try to funnel traffic directly to the village for some time. So we've heard a lot of you don't want to answer our phone numbers, and that's because it doesn't come up on your caller ID or you don't recognize the name or number. So we just want to remind you, if you see a phone number that starts with 559-430-82, that is a San Joaquin Gardens phone number. So all of our phone numbers start with 559-430-82, and the two digits ending will be different based on who's calling you. So we know that you're receiving spam, and you're obviously screening your calls, which we appreciate. We've had lots of residents call saying, well, I didn't know it was you. So if you look at that prefix, if it starts with that 559-430-82, it's most likely one of our team members calling, and it is okay to answer. Does anybody remember One Rainy Day? I used to love watching that show. So let's celebrate our May birthday babies. Bob Dowell has a birthday on the 13th, as does Madeline Jones. Today, happy birthday to Barbara Volker and Catherine Dill. Tomorrow, Roger Jensen and Lawrence Preston. May 16th, Willie Pepper celebrates a birthday, and May 17th, a big happy birthday to Alan Johnson. So if you see these May babies, please wish them a very happy birthday. Give them a virtual hug or a physically distanced hug from afar. But we want to wish all of you the happiest of birthdays from everyone here at the Terraces at San Joaquin Gardens. The hunt for the gnome is on. So again, the gnome will be relocated every Friday. If you sight the gnome by 5 p.m. each Wednesday night, please call the Connect line at 430-8216 and tell them where you sighted the gnome for your name to be placed in the raffle. So again, have fun and happy hunting. And as a reminder, do not remove the gnome from its location so that others can enjoy in hunting. So the winner for this last week, I believe, Dennis, are you there? Are you going to do a live drawing of the winner? Oh, Michelle, you have to unmute him.
I believe I'm unmuted.
There you go. Are you ready to draw the winner?
Oh, I've been working on this all day.
Okay. Do you want me to stop sharing my screen so they can see you, or are you going to do some sort of interpretive dance as you pull the winner or anything?
Yes, I am.
All right, I'm excited. Let me stop sharing my screen. And then Michelle, make sure you're on speaker view for the
All right,
recording.
so can everybody see this bowl?
Yes,
Am I up there?
I see your blue bowl.
The blue bowl. All right, in this blue bowl are spaghetti strips of paper with all the names that Michelle sent to me. And to maintain the integrity of the drawing process,
Oh my gosh. Are you masking your eyes now?
yes, I'm going to make sure that this is a blind drawing. I don't want any questions. And if Terry's name gets drawn, well, I'll deal with that when time comes.
Okay.
All right, so here's the bowl.
All right.
They've all been mixed up.
Do you want a drum roll?
Yes, thank you. I think I only drew one of these. We'll see.
Okay, it looks like one. Uh-oh, don't flick yourself in the face. Okay.
All right. And the winner is Phil Walker,
Oh, a big congratulations.
who is really a
Phil.
walker. He's out there all the time.
It's
Very
right
appropriately
outside your door.
named.
It was right outside his door. Well, then he found it easily.
It was actually closer to our place than his.
Okay.
Congratulations.
We can see it.
Phil.
Thank you. We can see it from inside our screen door. It's that close.
Yeah.
All right, you're
Right.
disqualified.
It's right at the intersection of 3 sidewalks coming together. So it's in a very exposed location right now.
It's the other fountain.
Yeah.
Oh,
Yeah.
okay.
Yeah.
All right.
Well, thank
This-
you.
Congratulations. So we actually have our newest concoction. We had sugar cookies made and drawn in the shape of the actual gnome with riding the turtle. So it has actually been delivered right now by our
Oh.
cookie maker extraordinaire. So we'll be bringing that to you once the call is through.
We'll be waiting for the doorbell. So it's not going to be a sports car, I guess, this time, is it?
No, not this time.
Okay.
Maybe next time. We'll see.
Okay.
All
Okay,
right.
Jessica,
Yes, sir.
I want you to know that you see these?
Those look
Since
painful.
I've now reduced to doing things like drawings, and I'm assuming the next will be grand reopenings, that I have these scissors ready.
All right, well, let's paint them gold so they look more presidential, shall we?
There you go.
All right. Let me see